Hey everybody, welcome back to In Bed with a Millennial. I'm the Millennial, Javeda Bay, and this is my bed, and it is still Sexual Health Awareness Month. And last week I talked about what sexual health and wellness is. This week I want to talk about who and how to talk about sexual wellness with, but specifically one person in particular. So obviously you should be talking about sexual health and wellness with yourself. And by talking, I don't mean like literally having like one-on-one or one-sided conversations with yourself about it, but like, getting comfortable just like paying attention to it with yourself. But you should definitely be talking to your partners about it, friends, everybody, because talking about sexual health and wellness makes it just easier to talk about sex in general. Because we like remove the medicalization of it and then you just like talking about sex. And that's important. You should also, if you're a parent, be talking about it with your children because the internet is a scary place, I would say. I don't have a better descriptor. It's a scary place when it comes to learning about sex as a child. So you, as the parent, should be having these conversations. But the person we're here to talking about sexual health with is your doctor, because most people don't. I've heard so many people come like tell me like, oh yeah, I went to my doctor but I was afraid to ask them. But can I ask you? I love that people come to me, but I'm working on becoming a doctor, but not that kind of doctor. I'm not a medical doctor. So today we're going to talk about how, why, how to get better at, how to get more comfortable with talking to your actual medical provider about sexual health, because we got to. So let's get into it. If you're wondering why I'm choosing to talk about doctors, it's because I've previously talked about how to have conversations about sex with other folks. So you can go back and watch those to figure out how to talk to like children and like friends and partners and things of that nature. But I've never talked about talking to your doctors about it because I didn't think that that was like something that was an important conversation, but it is. I realize that I am me and everyone else is not me, and though I feel totally comfortable going into my doctor's office and being like, okay, cool, well, I did this thing and like my butt cheeks were spread and like blah 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 blah, not everybody's that comfortable. So how do we get there? How do we get to a place where folks are comfortable actually talking to their medical providers about sexual health, sexuality related topics? First things first, I need you to really sit and think and ponder and like review. Are you comfortable with your doctor? That's the first step, because if you aren't even comfortable with your doctor, you're definitely not going to be comfortable talking about sexual health and sexuality related topics with them. So take a second to think about that. And if the answer is no, follow-up questions are is it feasible, is it possible to find a new doctor that you would feel more comfortable with? I understand, like, depending on like insurance that you have, you got to go to specific doctors. There might not be somebody else in your area. You might not have insurance and you're like, I just got to go to urgent care when I got to go to urgent care. And all of those are completely valid and true things, because we live in the US. At least I do. I don't know where you're watching from, but in the US, our healthcare system, so totally understand if you aren't comfortable with them, but you have limited options. That's completely fair. That's a reality that some of us do live with. But if you are someone that does have the ability and the means and the privilege to be able to switch doctors, I want you to think about seriously doing that, because you shouldn't be going to a medical provider that you're not comfortable with. Especially for folks that go to gynecologists. Like, general practitioners, you're like, yeah, it's whatever. Like, hey, can I get a flu shot? You should be super comfortable with your gynecologist. Super comfortable. So that is the first thing. Are you comfortable with them? If you're like, yeah, actually, I do feel really comfortable with my doctor. I don't know. It just seems like weird bringing it up. Again, completely valid, especially because most doctors don't like initiate the conversation. So you're like, why would I? Because it's your sexual health. That's why you have to be the one to initiate it. And I know that's a lot of pressure being put on yourself. Like, hello, it's a lot of pressure just being an adult and like making the appointment on your own. I was still trying to get my mom to do it well into my 20s, and she finally was like, you can do this, you're a big girl. But you have to be the one to initiate the conversation, because most times the doctor is not going to be the one to do it. So you have to get to a place where you're like, hey, I do have some questions actually before you go. I would say practice with friends if you really want to get used to or get comfortable with actually initiating the conversation with your doctor. And you might be wondering, Javay, why would I practice with friends? My friends aren't doctors. Well, A lot of the thing that makes it uncomfortable is that you're not used to saying most of the stuff aloud. So if you practice saying what you want to say to your doctor with a friend, you get used to actually saying it, and it feels a little less scary when you're like, hey, actually I do have a question. I felt a bump on my butt or near my vulva or like whatever it might be. If you get used to saying those words to a friend, it's a lot less intimidating and scary to say them to your doctor. So that's why I'm encouraging you to practice with a friend. Also, I just encourage practicing because practice makes perfect. Not actually, because perfect isn't real. I regularly have to remind myself that. But practice does get you more comfortable with things, and it helps you to actually better anticipate what it's going to be like. Because if you are neurospicy, sometimes that ambiguity really does a number on you. Trust me. So yeah, once you practice with a friend and you get comfortable saying the stuff, the hard part becomes when you're actually in the room with the doctor. Especially because sometimes doctors can make us feel like they are trying to rush us out as quickly as possible. But I'm here to remind you, you're paying for that visit. That visit is for you. It's not your doctor's health that's being looked at, it's yours. So be that nuisance. Take the time. Really, you out here paying insurance plus a copay to only be in the doctor's office for 10 minutes? No. Ask the questions. And you might be wondering like, okay, but what questions do I take to my doctor? Or what questions like can I just like Google or like come to you about? Good question. You should take anything to your doctor that directly relates to your physical body. You need to go see a doctor about that because again, I'm not a medical doctor. Don't bring me questions. Also, please don't be sending me photos of things over Instagram or via email being like, is this normal? Baby, that's not my wheelhouse. So anything directly related to the physical body, definitely take it to your doctor. Anything, if you are trying to make any changes for the benefit of your something sexually related, be it your fertility or what, take that to your doctor. And I know, you won't even understand how much I know. The internet is a scary place, and there seems to be a remedy for everything that you could just Google and find. And it's like, cool, go get these vitamins and do this, and you will be fine, and you will do whatever you want, and you'll be squirting like a geyser. No. No. Unless you were going to somebody that's like a holistic, like herbalist that has some studying under their belt that actually understands things, understands the human body and how things interact. Please do not think that referring to the internet and a good old Google search is going to answer your questions. That's not, no. A Google search might find you somebody that's like holistic, or an herbalist or someone that's non-Western medicine, which I'm totally in support of. But don't just think that just because you ran through Google and it says like, oh, take magnesium and you'll fix your PCOS. Yes, I'm talking to myself right now. Did I fall for this? Yes, absolutely. But trust me, I've done it. Don't do it. The internet is not one size fits all. Sexuality is not one size fits all. So why would your sexual health be one size fits all? So don't think that the internet is going to solve all your problems. Sometimes you do got to actually talk to a doctor or some type of professional that understands the way things interact with each other to help you get to the goal you want to get to. Granted, I don't think you should go to the doctor and ask them like, how do I squirt better? Because fun fact, most medical programs don't actually have sexuality area built in. But if you have gone and done your work of finding a really good doctor, more doctors nowadays are like actually working to learn more about sexuality as it relates to their profession, because like, I don't know, they go together. But back on track, talking to somebody about the questions you have is a really good idea. And if you're not sure if the question is something that should be directed to somebody like a sex educator or a medical professional, you can start and ask the sex educator, because I promise you the sex educator will be like, baby, not my wheelhouse. You need to talk to somebody else about this. We will let you know. But definitely don't just think that the internet is a good place to go. No. Having a direct conversation is a good place to go, especially with your doctor. So don't be intimidated. Also, it's your doctor, especially your gynecologist. They are up in your hoo-ha. They are in your vulva, your vagina, seeing your cervix. I'm pretty sure that if you ask them about a bump on your boobie, like, is this a mole? Is this a pimple? Should I be worried? They're not going to bat an eye. They've seen your cervix. So when you think of it that way, and for folks that don't go to a gynecologist but maybe have a prostate, they done stuck a finger up your butt and told you to cough. Like, come on. We can ask them questions, y'all. And if they respond in a negative manner, more proof to get out of there. We don't do, like, just like we don't yuck other people's yums, our medical professionals should not be shaming us for diddly squat crap. And I have left plenty of doctors because they would slut shame me. Every time I went in, I was like, can I get STI tested? And they're like, again? Yes, again. You should be happy that I'm doing this. It's your job to really push forth public health. STI testing falls into that. So if you get a vibe that they're judging you for caring about your sexual health, give them the boot and leave them a review. Because most of the insurance websites, you can like look up doctors and you can leave a review. Let them know like, hey, this doctor actually was really judgy about my sexual health and wellness. And if that's a priority for you, keep that in mind before you go visit them. Call them out. Let them know. We don't need that. But yeah, please, 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 please work on getting comfortable with talking to your medical providers about your sexual health and wellness. Because me as a sex educator, I can get you part of the way. Other sex educators can get you part of the way. But it's got to be a joint effort, a team effort. And on that team is a medical provider. But yeah, that is that. Make sure you subscribe to this YouTube channel because if you're not, you don't want me beating you up. Like, I'm trying to be on your team, but I'll fight you. Definitely make sure you follow me on all the social media platforms because they've got more goods for you. And definitely make sure you subscribe to my email newsletter because, as per usual, the internet, it's a scary place, especially for me as a sex educator. And sometimes they like to give me the boot, and I don't want that. But if you want to stay in touch with me, if I do get the boot, that's where you can do it. And definitely make sure you come back next week because I got an all new episode for you because I love you. I care about you. I want you to get some good sex ed. But yeah, until then, I'm going to see you later. Deuces.